The hybrid OR today is the work environment in a place to perform modern vascular surgery. Endovascular techniques have more or less taken over the majority of operations, and we use this technique to reduce the risk, the morbidity, mortality of operations. It reduces length of stay, and it is the preferred approach of most patients. The hybrid operating theatre provides us with the best of both worlds. So we have good lighting, sterility, operating theatre facilities. At the same time, we have high-end imaging, as it is only available in X-ray departments in the past. In the early days, we used small mobile C-arms. They were analog, they had small generators, they tended to overheat, and they were not integrated with the operating table. The next step in the development was to take fixed system into the operating theatre environment. These are either fixed on the floor or suspended from the ceiling with large rails. These rails interfere to a degree with the operating lights, and they interfere with the sterility because dust can collect on them and they could therefore contaminate the wounds. At the same time as the introduction of fixed system, there was a transition between analog and digital imaging technology. This makes it possible to have a much smaller system, lighter system, or mobile system, and these systems can be used now to acquire CT-like images in the operating theatre and also three-dimensional angiography. Although this new technology lends itself to be used for navigation, because these images can be overlaid to the patient, and that makes it possible then to move the catheters and guide wires through the patient without having to give further contrast. These images have to be created each time on the table, and that means you have to give more contrast, and that way you lose the advantage you would have using these techniques. Modern computerized imaging systems make it possible to upload already existing CT scan data to the system and then merge them with the live images created at the time. That makes it possible with this overlay to navigate through the vessels of the patient, and this is called fusion imaging. So this fusion technology reduces the dose area product for the patients and reduces the amount of contrast we need to give. Pretty much all the high-end systems on the market are able to do this, but it is so far something which takes a lot of pre-planning and is cumbersome. The GE Discovery 730 has been developed with endovascular specialists. It has a very simple registration setup to create fusion imaging. The workstation of the system is used to upload images from the hospital system. These are then merged with images created on the table, and this can be done with a few clicks of a button. Once the registration has been performed, on the large monitor we can then see the reconstruction of the arches moving with the gunshi synchronous. So we can then blend this in with live images of the guide wire moving through these arches, and this works seemingly with very little delay. As endovascular and vascular surgeons, we have always liked mobile imaging systems. They're easily moved out of the way when we need access to the operating table. The GE Discovery makes that possible. It is self-driven, laser-guided, and it can be moved away from the table and back to the table when imaging is required. Because the GE Discovery is entirely mobile in the room, it can be pre-programmed to different parking positions. So it makes it possible to have a lot of flexibility with other equipment in the room. We don't have it fixed somewhere. It can be moved, and that can be changed at any point in time. Here at Sunderland Hospital, we're very excited to have installed the first GE Discovery system in the United Kingdom. This hybrid OR shows the commitment of the Sunderland Trust to high-quality vascular services for the patients here in Sunderland and in the south of Tyne region.